Bore da pawb. Croeso, welcome to today's meeting of Powys Teaching Health Board. This is being streamed live and held virtually via the Health Board's website, and it'll be available to view after the event also. Later this afternoon, the board will hold its annual general meeting, and I do hope that everyone who wants to will be able to access that meeting and join us to share in the achievements of the Health Board made during the year 2020 to 21. Moving now to the agenda then, which is published on the website along with the papers. I will introduce myself, which is of course easier during a virtual meeting. I'm Vivian Harpwood, Chair of Powys Teaching Health Board. Also present today is Mel Davis, Vice Chair of the Board, who will stand in for me should my technology fail me. I hope that won't happen, of course. Independent members who are present are Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas, Matthew Dorrance, Robert Lewis, Francis Gerard, and Ronnie Alexander. Big welcome to you, Ronnie. This is your first official meeting of the board. So also present are members of our executive team, Carol Schilbeer, Jamie Marchant, Alison Davis, Pete Hopgood, Stuart Bourne, Kate Wright and Claire Marsden. In addition, we have with us the board secretary, Andrea Blaney, who's here on behalf of the Community Health Council, and colleagues from the corporate governance team who will be supporting the meeting. We have had apologies from Hayley Thomas, Deputy Chief Executive and Director of Planning and Performance, and Julie Rolls, Director of Workforce and Organisational Development, but others will be standing in for them. Please note that participants might look away from the screen from time to time when presenting to enable them to access documents. So just to carry on through the agenda, are there any declarations of interest today which we do not already know of? No, thank you. Can we turn then to the minutes of actually more than one previous meeting, and these really are for ratification and confirmation. So the first meeting is that held on the 26th of May 2021. So just in terms of matters of accuracy, did anybody spot anything in the minutes of this meeting? And I don't propose to go through page by page because there are so many of these documents today. Did anybody spot anything that needed to be corrected? If so, now is your chance to tell us. No? Thank you. Any matters arising that are not on the action log? Thank you. So can we confirm that that is an accurate record? That document is an accurate record of the meeting that was held on that date. Thank you very much. The next meeting then was the meeting held on the 10th of June 2021. Again, did anybody spot any matters of accuracy that needed to be considered again? No, thank you very much. Or any items arising that matters arising that are not on the action log? No, so can we confirm then that those are ready for signing off as an accurate record of the proceedings of that meeting? Right, thank you. And then the meeting held on the 29th of June 2021. We've obviously been very busy with meetings, haven't we? Same thing applies. Any matters of accuracy? Much shorter, this one. Thank you. I take it that there are not any matters of accuracy that we need to correct, and then the matters arising that are not on the action log. Good. So would you please confirm then that those are an accurate record of the meeting held on that date? Thank you very much. Right. There was, I think, an action log in the agenda. Could you please turn to that?
Chair, I'm happy to talk to this if
you would. Yes, please. Yeah.
So there's 3 actions included on the log, all relate to actions that have been transferred to the Performance and Resource Committee log. And just to confirm, we've recently held agenda setting for the September meeting, and all of those have been picked up through that process. And then the final action relates to a planned discussion around workforce sustainability, and we will carry that forward into the new committee structure.
Right, thank you. Providing, of course, we approve it today.
Yes.
I'm sure, I hope we will, because we have discussed it already. Right, thank you. So there is something to report of an in-committee meeting. In the interest of transparency, there was a meeting held in private relating to non-emergency patient transport services and a contract award. I'm not sure, Ronnie, I don't know if you'd like to speak to that. It's simply for noting, but I think it's all pretty clear.
Nothing to add, Chair. It's for transparency purposes. Thanks.
Thank you. Right, so that brings us to the next agenda item, which are reports or updates from the Chair, Vice Chair and Chief Executive. So I'll just speak to my own paper, which you have in front of you. First of all, I'm delighted to welcome Ronnie Alexander, our newly appointed independent member. I've already done that, but I'm just reinforcing it, Ronnie, because we are so pleased to see you today. And it's really positive that we have all independent members' positions now filled. That's not to say that there will not be a churn in the months to come. Really, the main focus, I think, in my paper is on the ministerial priorities, and those are listed for your information. And then finally, our charity, which I'll speak to again when we get to the reports from committees. But just to say, it has been a successful year for the charity. A lot has been happening, and we're delighted to have been able to award sums of money for projects. So that's all I have to say. If there are any questions. No, thank you. Well, I'll hand over to Carol Shillaby, our Chief Executive. No, I think a Vice Chair's next. Apologies, Mel. Your turn next, Mel.
So thank you very much, Chair. I really wasn't going to talk particularly to my report, except to say, obviously, the new minister is in post and the deputy minister, and there have been meetings with the vice chairs for both of those positions. And we have had letters back, which we'll be working through. And also that the partnership meetings, I would say, are firmly back up and running throughout the Regional Partnership Board. And also the North Powys, obviously, is back up and running. And that's really reassuring. So I'd leave it at that, but thank you.
Thank you. So over to Carol.
Borodar Pawb, morning everyone. So my paper has been pre-circulated, and I will assume that colleagues have had a chance to have a look at it. I too major on the priorities that have been set via the Director General, NHS Wales Chief Exec by the Minister. And important to note that those priorities do align to our annual plan that we approved at our last meeting. So that's very good news. I do just want to draw out, and I'm sure that we'll get an opportunity to touch on this later, but the current position in relation to the pandemic, and the sense that certainly at the time of writing, the numbers of cases were still climbing. We've seen a reduction over the last few days, but it is very clear that the system is under pressure, both in terms of increasing impacts of COVID itself with staff absence, etc., but also with the demand for urgent and emergency care, non-COVID related largely. We will touch on vaccination later, I'm sure, during the performance reports. But I'm also just wanting to underline that we continue to do our very best to ensure that our stakeholder community is aware of the current challenges and opportunities that we have. Pleased that we were able to host the Minister when she visited the testing centre in Newtown, and that we had an informal visit from Dame Kate Bingham, who obviously was the chair of the UK Vaccines Task Force previously. So just to bring that to people's attention, and we will touch on aspects that I've drawn out from my report in other papers throughout the meeting. Thanks, Chair.
Yes, thank you, Carol. And on that last point, I'm very pleased to say that the Minister, in my own appraisal, was very complimentary about the vaccines in Powys, how well we had done, particularly leading Wales. So well done, everybody involved in that. Right, now the second, unless anyone had any questions for Carol, right, we'll go on to the second part of the agenda item 2.1, which is going to be a key document for the Workforce and Culture Committee, if that committee indeed is approved. And in the absence of Julie Rose, Carol will take that paper and speak to it. It concerns the organisational development strategic framework refresh 2021 to 24. Carol.
Thanks very much. This is, as you say, Chair, a really important document for us. We signed off our annual plan at the meeting in June. The annual plan is about what we will do. The organisational development strategic framework is about how we will continue to develop ourselves as an organisation that is fit for purpose and is able to meet the challenges that we have in both the current climate and the future, but also based on the progress that we've made as an organisation over the last few years. So for colleagues who've been on the board for some time, you'll recall that the original organisational development framework was agreed by the board in May 2019. It was a 2-year framework that took us through to this period. And as the chair says, this takes us forward for the next few years. I was really pleased that we've been able to have extensive dialogue on the key elements that need to go into the new framework. We had a board development session where we had a significant discussion about the things that are really important for us to progress. We've had discussion at informal executive time and importantly at the local partnership forum, where that workshop really engaged trade union colleagues who were able to help us with this thinking. It was very clear that the principles within the framework were still extant and valid, and there is a direct tie back and correlation to those principles that are in our health and care strategy. So there was support for that. And that the OD framework is underpinned by our operating model. So the real focus on strategy, structure, people, process, and encompassed by culture. That is a common feature from the previous strategic framework as well. You'll see in summarising the cover paper the key revised priorities relating to each of those component parts of the operating model. So in terms of people, we're proposing that we continue to invest in our board and executive team development that focuses on improving our effectiveness as a board and as a senior leadership team. That we invest in leadership and team development, the core components of success throughout the organisation, really drawing through that culture of clinically and professionally led value-based healthcare, and develop our excellence in well-being, in leadership and in team dynamics. I'll just pull out a couple of other areas. We have taken opportunity over the last few years to restructure and make investments in certain areas. Our evaluation of that has been positive, but there is more to do at this stage. So we'll continue to implement an organisational design model that aligns to enable the delivery of the health and care strategy and invest in some specific organisational areas. We will, and I know the board recently had presentation on the Workforce Futures framework and our Health and Care Academy, but we will continue to develop further those innovative approaches that really underpin our grow our own model. On processes, I know that we'll be touching on governance later on, but implementing a governance programme that supports the development and implementation of our objectives, further enhance digital technologies and the way in which we use that, and strengthen our corporate business systems. And then if I can just touch on culture, we know that culture eats strategy for breakfast. So really key, and when we're talking about the proposed committee structures later, I would strongly advocate that our focus on culture is key to our success as an organisation. So we know that we've done a lot of work on this over recent times, but there is more to do. I'd like to just summarise then by thanking everyone who's participated in reshaping this organisational development framework. We will have an implementation plan should this be approved by the board, and it will be tracked by board committees, and then annually we will bring the progress report through to the main board. But I'd particularly like to thank Julie Rowles, Sarah Powell and their team for coordinating and developing this framework for our consideration as a board. So thanks very much, Chair. It is for discussion, but it is also, I hope, for approval today for this framework to take us through the next few years.
Thank you. Are there any questions? This is going to be really important. No? Well, in that happy event, could I please ask for your approval of the document? It is a very clear, very well set out document. Yes, I can see no signs of dissent. So, oh, Melanie, thank you. Yes, you agree, I hope. Yes, so I think the board does approve that. Thank you, Carol. Which brings us to agenda item 2.2, the All Wales Positron Emission Tomography Programme, known to us in the NHS as PET. Business case. A bit confusing for those who don't know what it stands for, though. It is not about dogs and cats and so on, goldfish or rabbits or whatever pets you may have. It does have a very specific, very important meaning, and we are hopefully going to get that approved today. It's been requested by WISC, the Welsh Health Specialised Services Committee. The business case was presented, I think, to the Collaborative Executive Committee and was approved or was supported there. So I think, Claire, you're going to take this.
Yeah, thank you, Chair. So thanks, Chair, for outlining very clearly what we have to do with this paper. So this business case was presented to the Chief Executive Group of the NHS Wales Health Collaboration, and they confirmed their support for the All Wales PET Programme business case on the 18th of May. At the meeting, the Chief Execs agreed to a request for letters of support from their organisations to accompany the submission to the Welsh Government. So that's the request we have today, to agree that we will send, our Chief Exec, Carol, will send a letter of support on our behalf. It's worth noting that the Capital, Estates and Facilities team at Welsh Government indicated that they were willing to accept the business case immediately following this endorsement. So as such, that business case has been submitted already. So just to add, the paper just outlines the recommendation, the financial investment that is proposed, and the plan over the next 5 years of how it will be implemented. So I'm asking that we approve a letter is sent in support of this, and I'm very happy to answer any questions.
Thank you, Claire. Robert Lewis has a question.
Thank you very much. I can see the need for more capacity in PET across Wales. I'm looking at this though from the Powys perspective. So my first question really is, are there other places, closer places, that people in Powys can and do go to? And the reason I ask this question is related to the financial side, because if we were to pay per scan, then that would be all right. But if we are contributing more to the infrastructure, then we might be contributing pro rata to infrastructure, which we will use less than other parts of Wales. And then finally, where's the fourth scanner going to be placed? I notice that there was a quote in the document. Someone said it's unacceptable to have to travel from Swansea to Cardiff for a PET scan. According to my AA planner, that's under 1 hour. And of course, as we know, in many parts of Powys, 1 hour is nothing at all. Thank you, Chair.
Thank you. Carol, do you want to take that?
Yeah, thanks very much. And Claire may wish to add in. Thanks very much, Robert. I think the points you make are really important. So we know that people in Powys, and not just in Powys, but people in Powys have been travelling some significant distance for PET scanning in North Wales and across the border into England. To some extent, we recognise that this is a sort of specialist type diagnostic sort of intervention, and the benefits of having that are felt to sort of most of the time at least outweigh those challenges about transportation. I have sat around the WISC table for 6+ years now, and we have been discussing the clinical need and demand for more access to PET scanning, and Wales unfortunately is behind in that provision when compared to our English colleagues. That said, opening up more capacity, we really do need to bear in mind it being as accessible as possible. So I know that the North Wales Centre is very keen that we see ourselves, particularly for the north of the county, saying accessing services in North Wales. I think there's a bit more discussion to have about the final site, Robert, if I'm honest, and we'll need to take into account the demands and the estates, etc. But wherever that will be, a key factor is accessibility. So my role on the WISC committee is to try to ensure that all Powys residents can access this. On money, there is something called a risk share agreement, an arrangement that we have with WISC, which gets calculated about how much we use of a service and therefore how much the contribution will be. The last risk share adjustment actually took place about 2 years ago. It did mean that we had an increased contribution. There wasn't a risk share readjustment last year because of the pandemic, but we have just gently reminded WISC that we will expect that to be reviewed again so that we can get the right level of balanced contribution from the Health Board. Because we're in the more unusual situation of accessing both South Wales and English system services for our population, we do at times need to split the contributions in relation to that. So we're used to having more complex funding formula, similarly for North Wales as well. So I hope that helps give a bit more background, Robert. This is one that is under development here for the next 5 years. At least I would suggest, so this will continue to feature strongly as a priority.
Thank you all.
Thank you. Claire, did you want to come in as well? I asked Carol because she sits on the joint committee, but I'm sure you may have something to add too.
Thanks, Chair. I think, yeah, I mean, we have good representation on that committee, so we are able to influence it. So I think that's really important. And there will be some public engagement on the full site, so we will have an opportunity to contribute to that. I think the other thing just to say, there have been questions around the mobile PET scans, and there has been quite a lot of public feedback about that they're not great. You often, this is a level of detail that may or may not be useful to know, but people having these type of scans often need to access a toilet during the process, and that means them going in and out of the scanner and accessing different venues and things, and that has been quite problematic for people. So a static offer is actually better for patients, and that's why this decision has been made for patient comfort and based a lot on patient feedback. So there has been a lot of engagement with the public on how we go about this piece of work. So just to add that, really.
Right, thank you. And I really welcome this because at the moment, many of the applications for PET scanners, which are so important for our patients, are being dealt with on an individual patient funding basis in WISC. So requests are made by clinicians very, very often, more often than you believe, for PET scans. I find that those meetings, chairing those meetings can be very lengthy and difficult. So I really welcome this new business case. I think we have further questions, one from Mark and a comment from Ian.
Thank you, Chair. Yeah, it was a very interesting business case and one which showed, unfortunately, where we are in comparison with many sort of comparators across the world. One of the issues I had with the business case is that the assumption for growth in terms of going forward is, I think, perhaps underestimated, because I think it works on the basis of something like 17.5% growth. England was at 18. So I think we need to look at that capacity and actually increase it if at all possible. And if otherwise, I think we're going to fall behind again. But it's to be welcomed in terms of seeing the progress. And hopefully it allows consideration of other scanning technology as well. I realise how advanced PET is, but there are other scanning systems which potentially could be looked at a sub-regional level, which again may fill gaps in that strategy as well. So an overall picture of scanning would be welcome from me.
Thank you.
That Chair, that tees up my my comments. So thank you for that, Mark. And colleagues will may be aware that I sit on WISC as well. And from my perspective, and from what I've seen in those meetings, the really important thing here is that we get the infrastructure right, the kit right and the provision right in this. And I think there is an issue, as the paper says, in terms of making sure that we've got the staff to cope with the growth that Mark talked about. But I think there is future discussion I would suggest that we might want to get into in terms of how we maximise the benefits of this investment and get those numbers up to where they need to be. And so some further work, as I see it, in terms of how we get those processes right and how we maximise the benefits for the people of Powys and Wales more generally.
Okay, thank you. Yes, it will be really, really welcome, I know, by our patients. Right, now we're asked to approve that business case. Do we approve it as a board? Good, thank you. So that brings us to the next item on the agenda. Thank you those who put a yes, a positive comment in the sidebar for me, for my information. Right, so the next item is very important indeed, and it's Claire Marsden again. So please, thank you, Claire, if you could come in with that.
Thank you, Chair. So this paper is a requirement for all health boards to produce an annual report which outlines the steps that we've taken to achieve our strategic equality plan. So this paper has just outlined really what the activities that we've had during this year, really. And I think it's really worth noting that despite the challenges that we've had during the pandemic, we've actually made significant progress with some of the objectives that we've had, particularly around Welsh language and also particular communities that are hard to reach. COVID's probably really highlighted some of the challenges that we've had, and we've been able to respond to many of them. So the paper clearly outlines the activities that have happened this year. It outlines the risks that are maybe still outstanding, and plans for the future. So I'm really happy again to answer any questions on this paper.
Right, any questions? We have had discussion of this before, I know, as a group. Trish, would you like to come in?
Yes, thank you. Thank you for the paper. It's really interesting and really good to see the progress we've made. I've actually got two questions. One is, the first is about the priorities that we've selected for 21-22 and the process by which those were identified, the priorities being Black and Asian minority ethnic groups, sensory loss and gender identity. And I'm wondering why those three and whether or not we've reflected on the need to eliminate inequality, the inequality caused by poverty.
Okay, shall I take that one first then, Trish?
Yes, please.
So thank you, Trish, for the question. We've actually selected those areas just because they've been really highlighted by some of the challenges that we've received from COVID, and there's been some national directive that we really have to look into those areas. As you know, there's new litigation that's saying we have to look at economic issues around our population. So that's a piece of work we have to do anyway this year, Trish, looking at, you know, each of our equality assessments, making sure that's something we take into account with every new piece of work that we do. So we've kind of taken that as a read that we have to do that now, as we have legal reasons to do it with every piece of work that we do. So we've not particularly set that as a target because we've just accepted that as a piece of business as usual. We have to bear in mind with everything that we do going forwards. That there are many areas that we need to look at, and I think one of the things we realise is if we try and do all of them every time, we can't really give them the time and energy that they might need. So we've looked at the areas that have arisen as issues this year and decided to spend some time on these. We recognise we need to do some public engagement, probably looking at this going forward, and that's been very difficult this year. And we will make some plans as how we do some more of that in the coming year going forwards.
Thank you.
Thank you. Can I ask the second question?
Of course, yeah.
Yeah, it's really our strategic equality plan, and the fact that it is really good that it's linked so closely with the IMTP objectives. But I'm wondering, given that a number of them are really about partnership activities and the way that we work in partnership to address the issues of equality, how will we as a board have oversight to assure ourselves that this is going forward?
Okay, I think, I mean, as the lead with this, Trish, I can report back on the meetings that we attend and the engagement that we are involved in. We work very closely with our partners. We have regular meetings with Pavo and the other equality leads across the whole of Wales, actually looking at what we're learning from our partners and what we need to do going forwards. As you know, we work very closely with the council. The volunteers would be a really good example of the work we've done this year, which has been done in partnership completely and very successfully, and certainly it's helped to contribute to our success with the vaccination programme. So that's a really good example of partnership working. So I'm happy to produce more guidance on the involvement we have with partners to do this piece of work to assure the board. I'm not sure if any other board members want to come in to say
yes, perhaps Ronnie can help us with that one.
Yes, of course. I recognise slightly ahead of the item, but the next item around committee structures proposes the establishment of a workforce and culture committee, and that committee would have a clear remit in terms of the equality agenda, diversity and inclusion. So I think that the work programme for that committee really can tie in the progress that we would expect to see on the delivery of that plan. I hope that's helpful.
Yeah, thank you. You're happy with that, Trish? That's reassuring, isn't it?
Yes, thank you. It's just about clarity about how we receive that assurance. Thank you very much, and thank you for the work.
Thank you. Melanie, would you like to come in?
Yes, please, Chair. I was just going to ask really on the second part of the paper, which is the workforce again, on the equality, and just very, really interesting work going on, which I wasn't aware of, about both the Menopause Cafe, the Neurodiversity Networks and the Career Wales career events. So I'm just highlighting this because I found that very interesting. I haven't heard about them, I wasn't aware of it. And I'd just like to say thank you for the information, but also ask for an update when we are ready to receive it, because I understand there's work going on, as the paper says, about the gender pay gaps in the report, which are the second half of the report again. And I understand that work hasn't been bottomed out yet, but I'd be very interested to know how that falls out, because it's quite interesting, obviously, because I thought we'd done quite a lot of work on that, and it's a different way of reflecting on that. And so I was again unaware of that and how we use that to get to understanding what the pay differences are and why. So I'd be very interested in hearing that when it comes back through. Thank you.
Thank you, Mel. Yes, the format in which we report that is set out as a template, but I know Julie Rouse is keen to look further into that and has commissioned a piece of work to look further at that at the moment, so she'll be able to update us when that work is completed. Thank you, Mel.
Thank you.
Thanks. It is important that that everybody gets to know about these developments. Matthew, you would like to come in?
Yes, thanks, Chair. Thanks, Claire, for the paper. Clearly, substantial progress against this area, which is always welcome. But I do have a couple of points that I'd like just to raise and talk through, if I may. Really pleased to see the establishment of networks for the advancement of underrepresented groups and minorities within the health board. That's really important. But I didn't get the sense that those groups actually influence or shape policy or change the way that we deliver services for them. So whilst it's great that they're established, what I really want to see is how that's making change. For example, I know that if you're an LGBT person, access to PrEP as a Powys resident is still a barrier. You have to travel outside county for a number of assessments. So how is the LGBT plus group affecting change on that to ensure that our population can have fair and equal access to people who live outside of Powys? that didn't come over in the report, and I think it's a missed opportunity, and it may be that they've not been able to do that, but at least it should definitely be on their radar. Furthermore, it was really good to see an establishment of a gender identity network. I think that's really great to start positioning this health board as a trans ally. I think that's really valuable. But when it looked at the workforce data equality annual report, we only gave people the option to define as male or female in a very binary way. So whilst it's great we've stood up a network, how is that influencing and changing the way that we support and scaffold our workforce and our patients to be able to freely express their gender identity rather than just seeing it in a very binary lens? I just welcome some comment and further commentary on that, please.
Yeah, thank you for that comment, and I think that's probably a really good example of our IT having time to catch up with our culture, if you like, going forwards, because changes in the way IT collect information take quite a lot of time. So I think there is a piece of work going on to certainly update the information we collect on patients across all equality areas, actually not just gender identity, so we can collect a fuller background of our population, if you like, and I will take that to Julie in Ward to look at how we collect our staffing information, so thank you for that.
Thank you. Yes, thanks for pointing that out, Matthew. There is so much involved in these developments to keep up to date, isn't there?
Yeah, I think it's really important that we're honest about it, Chair, and it's good to hear, officers saying that they'll take that away and work on it, because I think, honesty is great and we can make change. And I just welcome some further answer maybe about the how these groups are actually affecting policy change and access to health services. Gender identity was one bit of the broader point I was asking, so I'd welcome further comment on that, please.
I think the other thing to say is we have introduced a new equality impact assessment template that we are implementing going forwards, and that means that any new services or changes to services should be taking all these issues into consideration. So the format of that document takes people through thinking through all of these areas and how individual members of the population, whatever their challenges are considered, and really thinking about if any change to a service will affect any group disproportionately and whether we need to do anything specific to support that group. So hopefully as we go forward and people work and become more familiar with the equality impact assessments, we will improve in this area. I know Kat Cobley, our lead, is currently rolling out some training for people to complete these equality impacts assessments robustly, and she is available to support people who may be struggling to complete this and really think it through thoroughly. So that's the direction that we're taking going forward, is to really consider these issues around all the changes we make to services or any new services we set up.
You happy with that, Matthew?
I think Carol wants to add to that.
Yes, Carol, if you'd like to come in as well.
Yeah, thanks very much. And I think strategically it's fair to say that we're gathering some momentum now on the whole equalities agenda. I think we are still at a pretty early stage, to be honest, Matthew, just talking to your points in particular. And we've got a lot of work to do. I'm very interested in making sure that we've got a strategic and broad-based approach to this, linked in particular with health inequalities, and for people and communities who are more economically and socially disadvantaged, for example. But fundamentally, this is about how we develop strategic priorities, which get translated into operational priorities and must-dos. And this is about the evidence base, taking positive action and giving feedback. So your question about how change can be affected, seeing these groups come through, It feels to me as though this year's a bit of a transitional year, and we will, as we move towards the beginning of next year, need to think strategically again about the next big step that we should take. So I think this takes us so far, but we've got to weave in that more sort of systematic approach that will, I hope, respond openly and transparently to the issues that you're raising, and that we're able to demonstrate to the public that we are listening, that we consider, and then we take the action that we are able to take as a result of their feedback to us. So lots to do, Matthew, I think, but at least I do feel that this is now very firmly a priority on our agenda.
Yes, I can see that Rani wanted to come in. Bearing in mind that we're asked to approve the report before publication. So Rani,
thanks, Chair. I just wanted to add, Julie's not able to join us due to technical issues, but she is watching, so she's just asked me to feed in that the collation of information is via ESR national system, and she will feed back to the national team around the need to look at that process, and we can pick that up in a future committee meeting.
Oh, thank you, Matthew. Does that answer your questions?
Yeah, really comprehensive and helpful. Thank you, Chair.
Okay, thank you. Thank you, everybody. Well, I'm not suggesting, nobody has suggested that we make or suggest that we won't approve this, but can I ask you to confirm that you're happy to approve this before publication, bearing in mind that we will be obviously working further on it? Thank you. Thank you, everyone.
Thank you.
So now we come to the next agenda item, and I need to hand over to the board secretary, Rani Mallison, for this. A number of amendments to some of the board governance. So Rani, would you like to start, please?
Thanks, Chair. So the first item in this section is, as you say, amendments to standing orders. The paper provides an outline of those amendments as issued by Welsh Government in April. The board is therefore asked to adopt those amendments, and in doing so will also adopt amendments to the standing orders of WISC and ESC as our joint committees. There are no significant changes to the documents. The majority of amendments relate to updated wording and narrative to reflect changing guidance. And I wasn't therefore proposing to go through the detail, Chair. A summary is provided in the paper, and I'm happy to take comments on those. We will publish updated documents to the website and to board members following approval of those amendments.
Yes, thank you. I mean, it was rather an alarmingly long list when I saw it. I thought, oh my goodness. But yes, it has been summarised very satisfactorily. Does anyone have any questions then for Rani about those? I don't think we've got much option really other than to approve them, but is everyone happy to approve them? Right, thank you. So we'll take it that we are happy for them to be amended as suggested. So then to the next item, which is very important to us and which is something that we have discussed over recent weeks as a board.
Thanks, Chair. So this paper proposes amendments for the board's committees to be established with immediate effect. As you say, the proposal has been developed based on recent discussions with board members and also considers feedback from the board development session held in April, where we considered the effectiveness of our arrangements, and it also takes into account our requirements as set out within standing orders. So the paper proposes that the board has the following committees in place: a patient experience, quality and safety committee with the Mental Health Act Power of Discharge group as a subgroup, a workforce and culture committee, a delivery and performance committee, a planning, partnership and population health committee. And my apologies that the paper includes public health in the title, not population health. That's an error on my part. So sorry for that. And then the following committees which would continue as currently established, in that the Audit, Risk and Assurance Committee, the Charitable Funds Committee, the Remuneration and Terms of Service Committee and the Executive Committee. The paper proposes membership for each of those committees, and those have been taken forward in discussion with members over recent weeks. Terms of reference are under development, and we propose that they are brought forward to the board in September following development with respective committees. Meeting dates are included in the paper, and work programmes are also under development and would come back to the board in September alongside those terms of reference. Chair, I'm happy to take each committee in turn if that's helpful, but happy to open up for comment more generally if that's
yes.
Yeah.
Thank you, Roni. Are there any comments or questions? We have, I think, considered this at some length, so already, and people have been spoken to individually about it. Does anyone have a question? I think we've been pretty rigorous about this, Roni, and you've done a lot of work on it, I know. If there are no comments or questions, then are we happy to approve as suggested? Yes? Oh, Carol, would you like to come in?
Yes, thank you. It's a point of clarification, and Roni, I'm sorry, I should have picked this up before. On the Charitable Funds Committee, given that it is a charity, are the executive members, are the executive colleagues also members, or is this established as a more in the assurance lane? Oh, I think Roni might have frozen.
Yes.
Sorry, Chair, I was kicked out temporarily. I missed the question, sorry.
Yeah, sorry, Roni, just a point of clarification on the Charitable Funds Committee. Can I just check, are the executive also members because it's the charity, or is it an assurance committee? I just wanted to double check my my memory on it, really.
Yeah, sorry, I thought I had put that in the paper, that executive directors and independent members are equal members of that committee as trustee, as the trustee of the charity.
Yeah, great. I think it's just a typographical thing that's been carried over from the other committees. So it is a committee made up of executives and independent members. Yeah, great. Thank you. Thanks very much.
Yes, thank you. And as trustees, we all have very special responsibilities. So it's quite daunting, really, to know that, because it is an important committee. Right. So is everyone happy to support then in view of that? Nobody's changed their minds, I hope.
Chair, I think two members would like to come in. I think Trish and Ian.
Oh, right. Thank you. I can't see. Oh, yes, I can see. Yes, please come in, Trish. Yes.
Okay, thank you, Chair. I'm sorry it takes a while just to type everything. We have had quite extensive discussions about the new committee structure over the last year, and I think that it represents a big step forward, and I'm particularly pleased to see the focus back on our workforce and to have a dedicated opportunity to support and to understand what's happening in respect of our workforce. So yeah, really pleased to see that back, and I'm happy to approve.
Thank you, Trish. And Ian.
Yeah, and another one lined up perfectly for me. So thank you, Tricia. I was just going to comment on the workforce and culture as well. Such an important one. We talked a lot about the extraordinary efforts that our workforce have done over the last 12 to 18 months, and it's great to see that they're representing our priorities to our workforce, who are the ones that deliver what needs to be delivered for our population. So that's all I wanted to add. And thank you to Rani and colleagues for what has been a tremendous amount of work to make sure that all our bases are covered in this new structure as well. Thank you.
Thanks, Ian. There speaks the chair of that committee, so I'm glad you're happy with it.
Not a completely unbiased opinion then, really, Chair.
No. So is everyone happy to approve? Good, and thank you again, Rani. So
Thanks.
that brings us to the corporate risk register.
Thank you. So this paper provides the board with an updated version of the corporate risk register at July. In June, the board approved the annual plan for 2021-22, and that included some emerging risks that we had identified at the time. Those emerging risks have now been mapped against the corporate risk register, and executives with their teams have undertaken a thorough review of those risks to ensure that the corporate risk register now fully reflects the risk to delivery of the annual plan, alongside risks that could impact the overall operations of the organisation. That risk mapping is included within the paper, along with proposed changes to the register, and they are summarised in figure 2 of the cover paper. I wasn't going to propose taking us through each risk, Chair, but I'm happy to take questions. I can take us through each risk if that's helpful. It may be easier to open up for comments at this stage.
Yes, it may be that people have spotted a particular risk that they think they want to talk about, so perhaps we could do it that way.
If I could just ask, Chair, that risk owners support discussion,
yes.
That would be helpful, thanks.
Ian, did you have a question there, or is that an old request?
No, I do have a question,
right.
if I can. It's an old chestnut for me, but looking at the paper and the emerging strategic risks, and it is one that I've mentioned before, but it is one that I think is important. I do think there is an information / digital strategic risk for us here in the absence of an up-to-date and complete record. So many of our patient records are held in different systems, both paper and electronic, and I think that does represent a strategic risk for us. When I look at the page 3 or whatever it is with the emergent strategic risk, for me, there's a change management and a workforce sustainability piece relating to that. There's definitely one in terms of the potential for poor quality of care, particularly as so many of our patients are having to travel between different service providers, and the ability to have up-to-date joined up information is really, really important there for me as well. And I think there's an issue for staff in their ability to maintain numerous separate records. So I do feel very strongly that there is an information / digital strategic risk. The final bit for me is inequity of access as well, which we know digital poverty is an issue for us. Accessibility is an issue for us in Powys as well. So for all of those reasons, I think that's something that I'd like to see us reconsider as a strategic and ongoing strategic risk.
Chair, I can respond initially, and perhaps Pete and Carol could come in. Just to say, in terms of inequity of access, we can look to ensure that the mitigations around that include the digital elements. We can further work that up. That isn't a problem at all. In terms of the safeguarding of information element and records management, we will be bringing a paper forward to the Delivery and Performance Committee now in September around the work that we've been undertaking around records management improvement. And I was going to suggest, therefore, that we then take a view as to whether there is an escalation to the risk register as a result of that paper that will set out the progress that we've made and where there are further outstanding actions.
Ian, you happy?
That's good to hear, thank you.
Okay, thank you, Ronnie. And Carol, did you want to comment as well on that?
Yeah, thanks, Ian. There was a huge amount in what you're saying, and just to unpick some of that, inequality is key, and one of our emergent risks is in relation to that. That can be perpetuated in some cases by digital means, and we're really alive to that. And in this year's annual plan, of course, there is the work that we're doing to help to support people to digital inclusion, really people to be able to use the technology. I think this is one, in fairness to you, that you have raised from time to time, and I think we do need to keep it on our radar. I think the last year, 18 months, has been a real accelerator in terms of digital, and I think we're raising our ambition and our own expectation as well around what we can and should be able to achieve. And there's some very important aspects in the digital part of the plan. But as Ronnie said, let's keep this under review, and if we feel that actually there is an increasing risk, or there is more that we should be doing, that we can look to reflect that through this process as well. So hopefully that's reassuring that we're recognising the issue, Ian.
Thank you.
Thank you. Yes, I knew, I had somehow a feeling that Ian might raise that. So thank you again, Ian. Mark, did you have a point to make?
Yes, thank you, Chair. It's around risk 5. And just wanted some clarification if I could. We've altered the risk target in that instance. We've kept the risk score the same. So am I correct in thinking that that reduces that in terms of the overall risk profile?
Thanks, Mark. I know Hayley's not with us, and I will try and respond. And Carol's happy to come in as well. But from my perspective, in undertaking the review of the register, we looked at risk target in line with appetite. There had been little movement in terms of the management of this risk, and the target was very low. And so we'd had a discussion about, is that target ever realistically going to be achieved? Or will we need to accept that there will be a level of risk that we always have to tolerate in relation to this? So there was an adjustment of the target level rather than the risk that we hold and the profile around that. So that was from my perspective, but Carol.
Yeah, just to add in, Mark, Ronnie and I gave this one a good going over in terms of as we were discussing this, because this has been on our risk register for a long time. This is really about, so is health provision being compromised by our health board estate? And we really started to take apart likelihood and impact, bearing in mind the investments that we have made over the last few years. And again, you'll see later on, obviously, the capital investment's gone up again this year on some of what I'd call the fundamental elements as well around health board estates. So I think we reflected that really the likelihood has been reduced, and we were thinking in that regard, particularly about what our level of tolerance is. Can I just give an overarching comment on the risk elements? We know that we're, again, a developing organisation in terms of risk management. Some of the challenge that I've been putting in is really about whether we are a bit too, pardon the pun now, risk averse, whether we've really taken apart and got underneath these risks. And I know Ronnie helped us in an informal exec. We had some discussion a month or two back. We're going to plan to do it further. So just to give you some reassurance that these are very live issues, and we're really challenging, particularly where we've had a long-term risk that hasn't moved. So what is that about? Is it because we've been overly cautious? Is it because we're not taking sufficient action, or that the action isn't having an impact? So I'm pleased with the level of discussion we're having to get underneath this. So you might see a bit of this movement coming through. So please do, I'd encourage that challenge and questioning, because it's really helpful to us as an executive.
Thank you. It was understanding the approach. My sort of approach would have been more around when we've delivered on some of these, that would be the time to actually alter some of those, because what in effect I think you're doing is de-escalating some of that risk by changing the target. So it's more subtle in terms of perhaps risk registers I've used previously, but you don't remove the risk until you've actually delivered the output. But I understand the approach, and I think it's just useful to get a bit more detail around that. So thank you.
Thank you, Mark.
Just to add on that one, if I can, the Performance and Resource Committee did recently receive an update on the estate more generally. I know that we are looking to keep that as a more standard agenda item coming through. So the committee will be able to monitor this risk more closely in terms of mitigating actions and progress. Just wanted to add that in. Thanks.
Thank you. I think we have, Ronnie, thanks to you, come a very long way on risk. We've come to understand it much better, but there are always questions I'm sure that people will want to raise. So thank you. I think Melanie was next.
Thank you, Chair. It was really just to acknowledge the new risks in the register. Really, more than anything else, in case any of the public are watching or want to reflect on these, this particular committee. And just to say that the detail is further in, obviously, on what we've done to mitigate those and what we're doing, and also they're reflected in our performance reporting, because I think it's really important as they do reflect a lot of the delays in the access that we're seeing, both secondary, primary and community through the pandemic. They're a reaction to that, and they're positioning ourselves as a board, aren't they, so that we understand them and we understand where we're going with them. So I just thought maybe out of all of the different risks that we've had, because some are quite long-standing ones as an organisation, those new ones are worth sort of just shining a little light on to say, look, how we're responding, how they're part of the organisation and how they're being woven into our response to it. That was all. So thank you, Chair.
Thank you. Did you want to respond? Or I think, yes, it's a fair comment, Mel.
I'm happy just to add, Chair, that for me, the risk register is a key document that should inform the board's focus and business for the year ahead. And I think there's some work for us to do in reviewing our reporting templates, etc. And the opportunity that there is for us to be really clear about where papers come through, that they are in response to those risks that we've identified. So we can pick that up now to make that more transparent for the public. Thanks.
Yeah, thank you. Trish, you're next, then Jamie.
Thank you, Chair. It's building a bit on Melanie's comment about the new risk, but I was looking at the new risk CRR4 around partnership, ineffective partnership working and governance. And I wonder, given that so much of our work this year is with partners, why you've scored the impact as 3, and whether or not somebody could talk me through that.
I don't know, do you want to come in on that, Ronnie? Or
sorry, Chair, I was just getting the paper. So score of 12, impact 3. So this is about the governance arrangements of our partnership working at this stage. This isn't about the effectiveness of our partnership relationships. So this is about us being clear as a board about where delegations of decisions are made, how we bring through assurances and structure our business to bring through the elements of partnership working, rather than the effectiveness of the relationships, if that makes sense.
Okay, that's helpful, thank you. Yeah.
Thanks, Trish. And I think that the new Planning, Partnerships and Population Health Committee will have a key role in monitoring this risk, being clear that we are strengthening our governance arrangements, and that therefore our relationships are effective and we're delivering on those plans and agendas with partners.
Okay, thank you. I'm chair of that group, so that'd be interesting.
Thanks, Trish.
Thank you. Jamie?
Yeah, thanks, Chair. I won't turn my camera on because a brief comment is that thanks, Mel, to recognise your comment. I think you're referring to CRR 13, which is the one that shows the combination of our provider performance, but also primary care and GMS in particular. I think you're absolutely right, Ronnie's comment. This is a key piece of work that we're continually focused on, and does demonstrate the actions that we're taking and will continue to take. And also flag up to colleagues, of course, as you know, that on dental, we've taken a paper through one of our committees in recent weeks. Out of hours is coming to P&R committee in September. And also access went to our experience, quality and safety committee in recent weeks. So it's holistically showing the work we're doing in partnership with our contractors as well as a provider directly. But thanks for flagging up, Mel. It is a new risk, and we continue to finesse and manage and focus on that in the coming weeks and months.
Thank you. Thank you, Jamie. I mean, it's very good to have had this opportunity to review the risk register, because it's very important to keep our eye on it and keep refreshing. I think it's there have been some very, very useful comments made, so thank you, everyone. I'm wondering now whether we can move ahead and approve the proposed amendments. Everybody content to do so? Thank you very much. I can see that people are, so thank you. Now that brings us to the time. Well, not quite the time, actually. We've exceeded ourselves this morning. So in advance of the time that we'd originally scheduled for a comfort break, which was 11:35, can I ask if you're content to have a comfort break now? It's by my watch about 10 past 11. Can we come back, please, at 20 past? Or would you like a little longer? Time to grab a coffee then anyway, and come back please by 20 past, and we'll see how many people we've got on board at that time. Thank you very much. Right, thank you. I think we've had sufficient time to grab a very quick coffee, so pleased to resume now. And we start with the agenda item 3.1. The items in this section of the agenda are for information, discussion, and where relevant, if people would like to express their support, and of course questions can be asked. So I'll hand over now to the Chief Executive, Carol Schiller-Beer, to explain the Health Board's response to the Brontleys Wellbeing Park Community Land Trust's vision document.
Thank you very much, Chair. I'm pleased to be able to bring forward this paper, as you indicate, for discussion and for noting, so there is no decision on this. And the purpose of the paper really is to provide an overview as to the Health Board's response to the Brontleys Wellbeing Park Community Land Trust's vision document, which was published a couple of months ago now. And this is a really important paper, I think, because the key thing for me to say at the outset is that the site at Brontleys continues to be a major site for the Health Board in the provision of health and care services. And I've been in Powys for 12 years in August, and I remember when I first arrived, there was became quite quickly a clear question mark over the future of the provision of services on this site, and therefore there had been a history of the uncertainty about the commitment of the Health Board to the Brontleys site. I'm pleased to say, and just to remind colleagues, that back in January 2019, so the time before the pandemic, we were able as a board to publicly affirm our commitment to the Brontleys site as the major site for provision of health and care. But we did at that time indicate that it was not a priority for major capital redevelopment under the then new health and care strategy. What I would like to draw to colleagues' attention, though, is the significant investment that we have continued to make on the site. And the paper gives a flavour of the things that we have made those investments in. And currently I'm on the Brontleys site at the moment. The renovation of Basil Webb and our connections and our ambitions in developing the Health and Care Academy are very visible for all to see. We have been bringing buildings back into use, and I'm currently in Glazebury House, which is the headquarters for the Health Board that we brought this part of the site back into use in 2015. When I look around, some very demonstrable improvements to the site, and we've spent in the region of £4 million on the site since 2016. So I do hope that these are very visible signs to the public who perhaps felt that there had been a question mark about our intent, that question mark can now be completely removed, and people can be reassured of our long-term intention here at Brontleys. So it's in that context that our response to the Community Land Trust's vision document has been made, and we can see there are connections within the paper to the detail of the vision document, but also the exchange of correspondence about our position to be able to support in part or even in whole the vision that is laid out. We are intending to meet with the Community Land Trust, and I know that meeting is being established, so that again we're able to put across very clearly our position and take any feedback on that. But given the amount of consideration that there has been, I think the Health Board is pretty secure in its position in terms of the importance of this site for health and care. And in so doing, I think the opportunity to develop further the chapel, for example, and our grounds and gardens for the benefit of patients and staff. So I wasn't planning to take us through in detail, Chair, the core aspects of the report that's been provided, and there is a lot of detail in the background documents there, but very happy to take any comments and questions on this position ahead of the meeting with the Land Trust. Thank you.
Thank you. Francis Gerard, an independent member, has a question or comment.
Well, it's basically a
I think we're having trouble hearing. Francis, I don't know if other people are having difficulty, but I think there's a problem with your connection. If you could try to get that back, we would like you to come in if possible, of course. I'll take Melanie.
Apologies.
Oh, there we are.
Perfect. Sorry about that, internet problems. But basically, and also, can I, the one thing that those of us who've had to do things with mass events have realised is also how precious your outside space may be in the future if we have anything similar to the current COVID in terms of carrying on education for people, because, you know, so it's enormously important that we preserve those wonderful resources as we have them. That's my only comment.
Thank you, Francis. Melanie? I think we've now lost Melanie. Susan?
Sorry, Chair, I hadn't taken my mic off.
Oh, all right, sorry.
My fault. I was just saying I had reflected on these papers, and these are obviously, the Wellbeing Park is a community group that's local to the area and is obviously very keen to try and enhance the provision that they see in our area. And I read them, and I do think, and I've obviously been part of that journey of the conversation with the people that represent the group. And I do think it's a real shame that right the way through we haven't had a sort of a sense that it is a concern that the community haven't understood our message to say that the actual site is in use and has been since, as you've just outlined, 2015, proactively engaged in updating the Bronclis site. And those conversations have almost been blank with us. And I do think it's important to point that out. I know we've been in conversation with people, and I know that we're trying to support people working on things like the chapel, but it is particularly difficult, and I think it's worth. So I welcome this because it outlines that journey through, and I hope that members of our community that are local to the Bronclis site read the full documents on. It's well over a decade since this site was anywhere near under threat. The work that's gone on has been comprehensive and continues to be so as an investment from a health board point of view. It is very sad, I think, that the conversation has just been about developing this site for housing and for other elements like that, which we're never going to, from my view and from the backgrounds and the information we've had, be realised. And I think it's important to put that out in front of the committee as well, because I think that we do need to move on from this and continue our business, particularly in this particular climate with the pandemic. Thank you.
Thank you, Mel. Susan Newport, independent member.
I just wish to say to the board and the public how impressed visiting nurses from Cardiff and Vale and Anara and Bevan health boards have been. They're very impressed with the Bronclis site and indeed have said, you know, how fortunate I and we are to be based there. I think we're very lucky indeed.
Thank you, Susan. And I would add to that the site is crucially important for our patients, in that, you know, we have people being treated for some quite serious psychiatric illnesses on the site, whose confidentiality needs to be respected. Some are brought in by the police under Section 136 of the Mental Health Act. Then we have other people on that ward who are recovering and who need uninterrupted peace in beautiful surroundings. How fortunate we are as a health board to be able to offer them that. Again, we have a palliative care suite, which was for which we thank the Friends of Bronclis Hospital who contributed to the refurbishment. It's a lovely, peaceful site there. And of course, we have a mortuary. All those things are very, very powerful arguments in favour of retaining our commitment to this hospital site. I can see, Carol, did you want to respond? And Ian wants to come in as well.
Yeah, Chen, perhaps I can come in at the end after Ian, if that's okay.
Ian?
Thank you, Chair. Thanks for the paper. I think it was clearly laid out a lot of detail in it. I'm just reflecting really on the fact that I don't have the history, but certainly nowhere near as Mel has mentioned earlier on. But I am aware that we've spent a lot of time talking about this as a board, and I think my reflection is that there is that the Land Trust are either unable or unwilling to accept the health board position, and I am concerned. I think the meeting is crucial, but I do have some concerns that we seem to be unable to change that unwillingness or enableness, if there is such a word, to do that, and it is occupying a lot of health board time and taking colleagues away from, you know, what has been really important work over the last year. I mean, we've had an unprecedented year, and this issue in the middle of it. Clearly, it's really important to engage with our community. I accept that completely, but as an independent member, I'm concerned at the disproportionate amount of time this is taking for the board at these unprecedented times.
Yes, thank you, Ian. And further to that comment, of course, we are willing to work with all our community groups, and there is common ground, but on a very limited basis with this particular group. You know, we know that work could be done on the gardens and the chapel and so on. And we're more than willing to engage with all of the interested community groups on those sorts of projects. Mark, would you like to come in?
Yes, thank you, Chair. It was a good report in terms of giving me some of the background that probably happened before I joined the organisation, so I welcomed that. I think it's picking up a couple of points from earlier. there's very specific situations in which a community land trust is actually relevant to taking forward projects, and that tends to be in terms of securing funding and mechanisms which other bodies probably couldn't access or wouldn't actually find relevant. But this isn't one of them. The land is owned by the health board, and I can't see any reason why that would change, and no advantages to that happening in terms of a transfer of anything to a community land trust. There may be other projects in the area which would benefit from their input, but I just don't see it as being applicable to this particular site.
Yes, thank you. And I do think that there is legislation in England which is used by community land trusts, but that does not apply in Wales. And thereby might arise some of the confusion. A quick comment from Susan.
Thank you, Chair. It's just that I feel very strongly that the work ongoing must always be for the benefit of our patients and our staff. Yes,
thank you. That's precisely. Carol, are you ready to?
Yeah, that's great. Oh, thank you very much to members for the comments. I'm just going to reflect on a couple of them really. I'm first of all to agree with Francis that outdoor space has never been more important or valued, and I think that there is certainly potential for us. We've been discussing the outside learning space at Basil Webb more recently, so that is potential further development. But also the wider grounds themselves, and I know that there's a lot of enthusiasm around that. We personally, some of us as execs have had walking discussions as we walk around the site, and there are different ways of doing work and exploring and using the outdoor space. I think there's a couple of comments that were made reflecting really on the communication and engagement, particularly with the Land Trust. And if Hayley Thomas had been here, she would be able to attest to the number of interactions that there have been, and herself and Wayne Tannehill. And I'm grateful to both of those colleagues for looking to build those engagement and communication opportunities. And so, yes, I do agree. It's rather disappointing that we've got to a place where we have had to say pretty publicly about our position. And we do that for the avoidance of doubt, because the last thing we want is for members of the community to think that 10 years on, as you say, Mel, that there is any doubt about our commitment to this site. I also hope, particularly picking up Ian and Mark's comments, that putting our position out here can help to draw a line now, because there has been a lot of dialogue. We're an extremely busy organisation, still in a pandemic, and still trying to focus on the harms and the broader issues and impacts that have been on our population. So I hope that this report does help to clarify that position substantially and enables us to move forward. So I'm grateful for all of those comments, and in so doing wish the Land Trust well in pursuing those other areas that Mark has highlighted, because I would just say I think they're a very motivated group, and I'm sure that benefit can be drawn in other parts of the local community, but unfortunately not to the scale of their ambition on this site. So thank you very much, Chair.
Thank you, Carol. And just to round that off, this site is for the benefit of our patients who live in the area. So, you know, it is very, very important that we protect it and ensure that it's used for that purpose and for educating staff and new staff for the future. So, thank you. Perhaps we could then, I'm very grateful to everybody who contributed to that. We have suggested a date, the 1st of September, when we might meet with this particular group. and we'll see what the response is to that. The next item, agenda item 3.2, will be presented by Claire Marsden again, Director of Therapies and Health Science.
Thank you, Chair. So this is an item for information. As people know, I've been in post for almost 18 months now, but it was an opportunity to take stock of the time since I've been here, really, and reflect on the therapy and health sciences services, bearing in mind that the post had been vacant for some time since I've been here. So just taking the opportunity to really look at the situation when I arrived, the key developments since I've been here, and really an opportunity to look forward and think about what we want to achieve in the oncoming times and challenges that we've got ahead, really. So I've just outlined these things in the paper, and I'm sure everyone's read it, so I'm very happy to take any comments or questions.
Yes, thank you. Very informative and interesting report. Trish? Oh, sorry, I'm looking at Robert first. Robert was first with the question, then Trish.
I think that congratulations are in order here for the range of work done, and above all, for the emerging picture of a long-term design of service. This group of specialisms is in the forefront of the repatriation of service, with all the benefits that that brings. But do you think, Claire, that therapies and health sciences will be able to have a significant impact in reducing treatment times in the years ahead by, for example, doing things differently? And what can we do to amplify and accelerate this benefit? So a very easy and straightforward question for you, Claire, but one that might give reassurance to members of the public in the years ahead.
Thank you for that question. Yes, of course, I believe that. That's why I do this job. I think the therapists and health sciences have a lot to offer to healthcare. I think you're absolutely right in picking up the key thing I think we can do, which is maximise independence and support people to return to their previous level of function. And we very much have a home first approach in Powys, that we always try and take people home first, because we know that people perform best and recover best in their home environment. So absolutely, I think that's one of our key skills. I think you're absolutely right. We have to evolve all of the time and look at new ways of working. And, you know, I think therapists have been really great at responding during the pandemic and embracing, for instance, virtual working. And that's certainly increased capacity, because travel, as you know, in Powys is a huge challenge for both staff and our populations. So whilst we know it's not the panacea for everybody, and some people need face-to-face, a mixed offering can be really beneficial. So some people might only need seeing face-to-face for some of their involvement with a therapist, whilst they can use other modalities at other times. So I think there's that opportunity. I think there's the opportunity to work with higher education and really look at the future of all of these professions and see what they can offer. We're looking at advanced practice in many of the areas. We're bringing in reporting radiographers into our organisations, so that there are extra skills that we can bring in. And I think also we need to look at some more multidisciplinary working, because we know we're better when we work together. And that's not just within therapists, that's with our nursing and medical colleagues as well. So I think there's a real opportunity for us to become more efficient and more effective in our working together.
Thank you, Chair.
Thank you. Trish, you were next.
I'm just very simply, thank you, Chair, just to say thank you to Claire for the report. It's really inspiring to see what's been done despite the pandemic and over such challenging times, but really good leadership and lots of exciting opportunities ahead. So thank you so much.
Thank you, Trish.
Thank you, Trish. Mark?
Thank you, Chair. Yeah, I wanted to thank Claire again for the improvements that she's made and the impact she's made in terms of the short time. I can't believe it's a year, but there we are, a lot done. One of the points I just wanted to explore a bit further comes under the challenges in one of the bullet points. And I think it's perhaps the most insightful thing and the important thing we need to do, and that's look at redesign of the service. And I think what's happened, she's highlighted, is incremental. And I think we need to change that and make it more substantive. And that is shown, I think, by recent problems we've had in terms of some recruitment. And until we start and get on with that and look at the time it's going to take to bring in recruitment, I think it's important to start that as soon as we can. And I was wondering if we could perhaps, I know there's a lot going on, but bring some sort of time-bound criteria to actually look in at taking forward that service redesign.
Thank you for the question. I think we have already started to look at that work and what we need. And I think all of the renewal priorities really have to take into account the staffing requirements that we have. And I think we're taking the opportunity with each of the renewal requirements to really look at the staffing that we need. And I think we need to take a long-term view on that as well. I think you're absolutely right. So we're working with HIW also to look at our future staffing needs, what students we need to develop in the future, how to attract people to our different professions. Certain areas we struggle more than others, and so we have to really think about, you know, where do we target people? Do we need to be going into schools, even raising awareness of some of our professions? Some of them are quite niche. And whilst everyone's heard of a nurse or a doctor, I'm not sure everyone's heard of a respiratory physiologist, for example. So we really need to think about how to raise the profile of some of our professions that we find more difficult to recruit to, and make those attractive for young people, really, because we need to be thinking way down the line how we bring staffing on board for our future population. So I absolutely agree. There's a lot of work to do there.
Yeah, I suppose what I was trying to get at is, for me as a board member, is to actually see, well, okay, what does that journey look like in terms of timescale? And it's just to give us some indication of, if we're looking over a 5-year time horizon, how we move forward on that, because budgets need to be aligned, recruitment needs to be aligned, and I think unless we get some sort of program in place, it's very difficult to judge how we're sort of succeeding in terms of that objective.
Yeah, and I think we will do a piece of work in the very near future looking at the sort of reconfiguration of staffing, and I think there is a national piece of work which has a 5-year plan with us looking how we are going to get the staffing that we need in our future. So we are very involved in that national piece of work as well, but we can certainly bring that back to the board at a later date with a plan. And I know Julie might have a comment. I think she's joined us now about, you know, the workforce work that we're doing going forward, which looks at all of our staffing, really.
I think Carol wanted to come in as well on that question that Mark asked. Carol?
Yes, thanks. Just briefly on service redesign, Mark, I think that's you'll start to see more and more of that coming through now, the renewal priorities, as Claire mentioned. Particularly, you know, there are 9 key areas, and particularly as the scope of those starts to firm up, some are clearly ahead of others. We started earlier on respiratory, for example, on the Breathe Well programme, and in the next item we will touch on some of these areas, and I think particularly in some of the new committees will be an opportunity to get under the skin of some of the key priorities and what they actually mean on service redesign. So a lot more to come on that, Mark.
Julie, would you like to come in?
Yes, thank you so much, Chair. It's lovely to join in full. I have been listening intently. Just to say, obviously, we have got the Workforce Future Strategic Framework, Mark, and I know you've been parties to the discussions in relation to that. There is a specific piece of work around schools as well, as Claire's identified, and working with schools so they truly understand the range of options. And just again, for assurance to the board, Carol has arranged a meeting. It's happening on Friday afternoon, I know, with HIW, with a number of key directors, where we're talking about how we specifically meet the needs of Powys, because I think as you've said, Mark, things become evidently clearer that the response we need within Powys is probably slightly different to the rest of Wales, and that grow your own approach is something that I know the board are committed to, and certainly something that we can see pull through in light of therapies. I would also say in terms of workforce design and planning, we are ambitious in relation to our therapies workforce, and we certainly have those ideas. So reviewing our establishments and looking at the roles that therapies and health science can play is a conversation I think we probably have certainly 3 times a week, but with frequent regularity at the executive committee. And obviously now we've agreed our subcommittees of the board, I'm sure we'll feature this discussion more prominently there as well.
Oh, thank you, Julie. That's really helpful. Very, very reassuring. Ian, you have a question.
Yes, I'm congratulations. I won't repeat what's been said before, but endorse it. I just wanted to open it up slightly in terms of reading the paper. It's very refreshing to read, and the change was obvious. And I'm just a comment probably for Carol really in terms of, are we capturing the wider organisational benefits here? Because something that we had an intractable problem with, I wouldn't say it's gone away, but we've risen to those challenges, or Claire's risen to those challenges as far as therapy and health science is concerned, and made a huge impact in a relatively short space of time. So just seems to me it's something we need to bottle if we can figure out what the heck it was, really.
Thanks very much, Ian. Just briefly, you know, I think the pandemic's changed everything. I think it's opened up permissions. It's helped some of our more innovative staff to stand taller and to provide opportunities for people to get on with things. We certainly picked that up through the first New Ways of Working report that helped to influence the annual plan priorities. And we will be revisiting that "what are we learning" type reflection. The other thing just to say is that we have been holding sort of showcase events digitally with staff groups, and therapies was one of the first to go through, actually the first I think on the showcase, and a tremendous opportunity to hear what people have been doing, but also the challenges and the next stage work. I'd welcome independent members to join those sessions if they haven't been distributed before. We can look to do that. We've heard from nursing as well. We're going to be going through a number of areas because I think probably across our organisation we will find more and more stories of where staff have been innovative, creative, flexible and adaptable to meet the needs of patients, whether directly or indirectly. So I think we've got to capture this moment after everything that's happened that's been so difficult. There have been things that have been fantastic, and I think this report is one of those that helps to sort of illuminate some of the work that we may otherwise not be quite as aware of.
Thank you. I think that probably concludes that agenda item, Carol, but thank you again. I'm very, very grateful. It's been a really useful contribution, Claire.
Thank you.
Right, Carol, if you would present the next agenda item, because I know that Hayley's unable to be here, performance reporting, the National Outcome Framework as at July 2021.
Yes, thanks very much, Chair. And if you're okay, I thought I would take both A and B under this together and then open up for questions. They are so connected, and executive colleagues with their lead areas may wish to contribute. So I'll deal first and foremost with the National Outcome Framework report. Board members may well remember that as a result of the pandemic, the broader integrated performance approach was suspended and replaced with a more narrow focused performance requirement from Welsh Government. That said, we did take an opportunity in our recent joint executive team accountability meeting with Welsh Government to give them a wide flavour of the work that we've been doing and discuss the challenges and opportunities. So, but I would say this is a report you are familiar with, and clearly we do have the Performance and Resources Committee that go into some considerable detail as well in relation to these matters. So I will just literally give you an overview at this stage. So the just on COVID update, I referred to it earlier in my chief executive report. We have seen fluctuation in the case rates. They've been going up significantly, and Powys was above the Wales average. We're now seeing them drop, and I think this would be the 6th day of reduction in the case numbers. And there is speculation, I guess, rather than concrete evidence about why that has happened, and commentary on that. But it underlines the importance of our testing, tracing and protecting service. Extremely busy, and I would say for any members of the public who do tune into these meetings, how important it is to secure a test if you have symptoms that you're concerned about. So testing continues to be key. I think we mentioned earlier the vaccination programme, Chair, in your report, and that continues to go from strength to strength. And I would just say that we are now in full preparation mode for the autumn and winter booster campaign and for taking forward the latest JCVI guidance on administration of vaccine to children. If we are talking about areas that we are needing to focus on, clearly improving health and well-being is absolutely critical, and we know that because there has been an impact in terms of the evidence we considered for our annual plan. So elements such as childhood vaccinations, smoking cessation, alcohol use, and of course flu. And we will be able to give you a bit more detail in September about the forthcoming flu campaign. But if I can stress to everyone how important the flu campaign for this winter is going to be, it is absolutely critical that people avail themselves of a flu vaccine, and we will be seeking to coordinate that where possible with the COVID booster campaign as well. Cancer services, we know that we've got a lot of catch up to do in relation to that, and the report outlines where we are at the moment. We have had some issues on national reporting, but we're making some progress there. And in terms of, I just want to draw out mental health, because that is getting a lot of attention, quite understandably, because of the demands and the sense of concern about well-being as well as mental illness in our communities, and we continue to perform very well relatively on mental health, and looking to expand a number of key areas. Pressure points in particular are around eating disorder services, specialist CAMS, but some also ambitious work around perinatal mental health as well as early intervention in psychosis. So there are some very clear areas. The urgent and emergency system is under significant pressure, and anyone that's tuned into the news over recent days and weeks will appreciate that this is a UK issue, and we are feeling it very hard in Wales. Significant ambulance service challenges in coping with the demand, and that again has had a profile, and we're working closely with the ambulance service on how to improve that. And then I just want to touch on elective or planned care. We are doing all we can to try to see as many people as possible in as swift a time as we can, but this is a significant concern to us in terms of the access times for people who are requiring some outpatient consultation or other planned care interventions. So there are some graphs in the report that demonstrate some of the improvements that have been made, important improvements as Powys as a provider. But I would want to sprinkle a very cautious note that actually demand for services is currently pre-pandemic level, and our capacity to deal with as many people is restricted by COVID infection control precautions. So at this stage, I'm afraid it is a worsening position rather than one that we're able to confidently say we're on top of. And that is in relation to particularly secondary healthcare, orthopedics, ophthalmology, a huge amount of work going on in relation to that. I, as I said, touched on mental health. The only other area that I really did want to pull forward is this focus on staff. We know that it has been a very challenging time for many staff, both in the personal lives and professionally as well. We do believe that having good quality PADR is helpful in supporting staff, so our focus is on that as well, although we can see some improvements coming through, but also supporting people with their wellbeing services as well. And then finally, I know that the Quality and Safety Committee did a detailed look at the concerns management and also mortality review. So I won't touch on that in any great detail, but you can see that that again, some improving performance and trajectories there, but still some way to go. I'm going to just pause there, Chair, to see if there's any immediate questions. I think I saw a question from Robert.
From Ronnie, I think.
Oh, Ronnie, sorry, yes, Ronnie, my apologies.
Thank you, Chair. I do, of course, acknowledge the unprecedented and sustained effort that there's been on vaccination, but there is still an issue in relation to people who have decided not to accept the first dose of vaccine. And I recognise that this is a voluntary decision, but I wonder if anything more might be done to improve that position. Thank you.
Yes, thanks very much, Ronnie. If Hayley were here as the lead for the vaccine programme, she'd be able to give you detail on this. But there is an element of the vaccine programme called Leaving No One Behind. Public health colleagues, Stuart and other public health colleagues are supporting the leadership of that area. That's really about interrogating data and information, because there's a number of reasons why people may not have attended. One may well be that we don't have their up-to-date details, and that potentially is more likely in the younger age group who are more mobile, or that there is a particular underlying concern of vaccine hesitancy. Getting to deal with both of those is key in trying to drive up the uptake. I've got to say the uptake in Powys is particularly good. It's strong. And across Wales, second doses are very nearly at 80%. So it was something that we could have only ever dreamt of really before the vaccine programme. But it does mean that, as you sort of rightly point out, 20% have yet to have a second dose. And some of that is about scheduling, some of that is about choice. And we will continue to work with people to avail them of all of the information so it is informed decision in which to people to make. But I know Stuart wants to come in on this, and he's a bit closer to this than I am. Thank you, if that's okay, Chair.
Yes, thank you. Stuart?
Thank you, Chair. Thank you very much. Just to come in on the very good description actually of the Leave No One Behind work that's happening under COVID-19 vaccination at the moment. What we're doing is we're looking at barriers really around age, geography, ethnicity, gender, because there is a gender difference, but also occupation as well among those occupational groups that are eligible. and we've done quite a lot of work just trying to understand for those different sectors what the levels of uptake look like at the moment, and we've done quite a bit of detailed analysis on that. In terms of what we're doing, we have been doing quite a lot of work with some of our care homes. We have got care homes where second dose uptake is less than we would like it to be, and a number of staff have been having one-to-one conversations with those care homes, what we call guided conversations about the reasons for vaccine hesitancy among those groups, and trying to talk that through, because it is a voluntary process, but it's important people have the right information when they make those decisions themselves. So quite a lot of my team remains quite a lot of time talking to quite a number of care homes in Powys about staff hesitancy for vaccination. The other pieces of work practically that we're doing right now is looking at a couple of things really. We have drop-in clinics now where people can just turn up and get vaccinated, and I think it's not massive numbers, but it's not insignificant, and they are finding people coming forward for vaccination now that perhaps didn't come when they were originally invited, so that's proving to be beneficial for us right now. And then the other area we're looking at is location. Access is really important, and we're looking at setting up some clinics in more geographically distributed areas. So Welshpool, for example, is one area that more than likely will be setting up more location-based clinics, either through centres that we can find up there or in conversation with primary care. So we absolutely understand that access is an issue as well for people. So there's at least 3 practical interventions that we're doing there right now to try and help with leave no one behind work, and there is also further work happening behind that as well. Thanks, Chair. I just wanted to try and bring that alive a bit more.
Thank you, Stuart. Thank you. Right, Susan.
Thank you, Chair. It was just following on from Ronnie's question, and to inform the board that we also have actually Medicine Management do run a COVID-19 information line. So there are direct referrals from the public, and a lot of that is around concerns of the vaccines, and we're able to address those issues and I hope give reassurance. And I know a lot of people have actually changed their mind and gone forward and proceeded with vaccination given that information. And it's staffed Monday to Friday. It's a very busy line, 8:30 till sometimes 6:30, 7 o'clock. And I think we've helped a lot of the public with that information.
Well, that's interesting. Thank you. Right.
Lovely, thank you, Chair. If I can move on to item B in there. There has been a report pre-circulated, but there are some slides, overview slides, which I'm going to dash through. So I think Caroline from the the corporate governance team is going to guide us. So you'll hear me saying forward slide, pretty rapidly. And again, this is hopefully a reasonably easily accessible way for the public also to see how well we're progressing against Q1 milestones of the annual plans. So next slide for me, please, Caroline, if you wouldn't mind. Just to remind colleagues that this is the plan on the page, so there are a number of components. 3 core components: COVID response, essential healthcare and renewal, supported by enablers, 4 enablers. So this is a dash through, and next slide, please, Caroline. So just in terms of COVID response, again, we will make sure that this slide pack is published on our website. Just to say that all actions in relation to a COVID response have been delivered or on track in terms of if there are further actions to take. And our prevention and response plan has been revised and updated, sent to Welsh Government. We are now preparing for the autumn-winter booster campaign, and that's on track in terms of vaccination delivery. So next slide, please. The next section focuses on essential healthcare. So the actions to improve health, promote health and well-being, childhood immunisation, flu screening, third sector support. I just want to draw out things that you wouldn't have necessarily seen in the performance report itself. So we have approved a weight management strategic plan, been working on that through a group that has been established to take that forward. And I'd also like to just highlight the elements around primary and community care with such a focus on this area. Jamie mentioned earlier dental service provision. There's a lot of interest in that, but we've also now enabled funding for an ophthalmology service expansion in the north, and we've agreed to revise the way in which drugs and therapeutics group oversight works, and improving the importance of medicine safety in our work as well. And just a quick note on primary care around second doses of the COVID vaccine, that's now complete. In terms of autumn and winter booster campaign, they will have a role. There's been lots of dialogue, but we're very mindful that primary care is extremely busy, and it's going to be a rather bumpy winter, we suspect, with the demands coming through. The next slide also covers essential healthcare. I think I've covered mainly the unscheduled care and out of hours, but picking up on Claire's comments earlier about therapy working, consultation on 7-day therapy working has been agreed to expand that service. And also just pulling through on musculoskeletal services, a review has been completed now in line with the actions we supported in the plan for the provider to understand exactly where we are and what the potential is to improve access. The next slide also just finishes off that section to say that we are continuing to be involved in COVID and wider planning with other organisations, including their silver arrangements. We've undertaken a deep dive relating to Shrewsbury and Telford NHS Trust. That is not yet fully complete. There are further dialogue to have with national agencies. And as we noted earlier in the meeting, the non-emergency patient transport element has been agreed. So all actions delivered or on track for delivery. The next section relates to renewal priorities, and I know that we'll get some specific time on these as we move into the autumn. And we've hit the ground running really in trying to ensure that the scopes are worked up and developed. Now, some of these are more complex, and the scope is quite extensive, and that is the case for frailty and community, but positive progress is being made on that and greater clarity is emerging. Claire touched on long-term conditions earlier in her report, but that work on long COVID is now established, but further work on the scope of the long-term conditions programme continues, but again, progress is being made. The next slide covers off the next two elements as well. The PET paper, the PET diagnostic paper earlier, is one element of a wider diagnostics commitment, really, from our point of view, to understand what the art of the possible could be for provision of diagnostics in county, as well as then enhancing ambulatory and planned care opportunities. There have been some real challenges in recruiting into the first stage of some of that planned work, particularly around theatre roles, and further actions being taken on that. So I would just highlight that the action's incomplete, not through effort, but just through the success of recruitment. And the same in some regard to the advice, support and prehabilitation. Significant actions are underway in terms of recruitment, however, they're not yet complete. The next slide just picks up the last of the newer priorities, and that's about children and young people. And most actions are delivered on or on track, and one action is incomplete. Again, that's about recruitment, but I would say that this renewal programme area is making very good progress. Couple of key elements then in terms of the next slide covers off some of the big four, and just to say that I mentioned it earlier, cancer work is progressing, and we have secured funding and recruited into some of the cancer roles, and that will provide a platform for us to be able to move forward. Again, then within mental health, some of the new proposals now have been submitted for the expansion in the areas that I highlighted a few minutes ago under mental health. The next slide just covers off the Breathe Well programme. We know that this has been more well established, and Claire mentioned respiratory physiologist earlier. So we've been seeing the impact of some of the investments that we made last year and into this year coming through, and we've further supported now the business case for the North and Mid Powys multidisciplinary team. So that's been achieved. Actions on track from circulatory programme. We have secured some support for the programme, but we will need to secure and align local clinical leadership, but we're managing some support from a national perspective on this as well. And then just very quickly, workforce futures, there's so much to say on this. I'm not going to go through in detail. Clearly, we've just agreed the OD framework today, and there's a connection to this area as well in terms of well-being at work and new ways of working. Our work on Chat to Change group, and our focus on agile and different ways of deploying work in the broader sense. The digital first element is on the next slide, and that just start. Oh, sorry, I've got more workforce futures. Julie would be so pleased giving this some particular profile, because in particular this is there's a lot of effort going into this, and in terms of the Health and Care Academy, Julie mentioned a meeting on Friday that we have with HEIW, and I think the workforce futures stream is really now taking off and delivering some important developments. And just to give a reassurance on workforce planning, we have secured extension of contracts to support some of our fundamental COVID response. On digital first, just to say that this is now a very focused, well-developed area of work in terms of expanding the use of platforms that we already have, ensuring that we're getting the most out of this technology, given that we've made the step towards that over the last year. And you can see that the Welsh Nursing Care Record and iCare digitalisation projects both now have project boards established and the governance arrangements in place, as well as moving forward on some other important elements such as the Once for Wales Concerns Management System. The next slide is innovative environments. I won't go through the detail of this. I know that many people are already aware that we're making progress, and on site at Machynlleth, the North Powys business case is continuing to be scrutinised by Welsh Government, and the Health and Care Academy development is progressing. And then just finally on transforming in partnership, huge amount, and Ronnie's presentation earlier on the governance papers are an important step forward. So the vast majority of those items are on track. We have now agreed where partnership governance will be particularly picked up, and I think that strengthens our position considerably. And I should just indicate to you that other parts of this part of the annual plan are on track for delivery. All the actions have been achieved, so nothing to escalate there. I'm sorry, Chair, that was such a rapid run through, but it was important to just pull out some of the key elements of the Q1 reflection. I think it shows how hard colleagues across the Health Board are working, particularly in the recovery and renewal space, but notwithstanding, we're not out of the pandemic yet.
Thank you, Carol. That was it was quick but very concise and clear. So are there any questions for Carol, please? No, very informative and useful to see how much progress actually is being made. So well done, everybody. Thank you. Can we move on to the financial report then? Oh no, yeah, financial report next. Pete?
Thank you, Chair. Thank you, Chair. So if I just introduce the finance report for the period ending month 3, the report's in the usual format included in your pack. If I just take us through some of the key issues and we can pick up any questions and then have any discussion at the end. If I just refer you to page 2 of the report, so as at month 3, we're £52,000 overspent against our revenue position, but hold a forecast position of break even for the end of the year. And against capital, we so far spent £589,000 to date against our total capital programme of just over 15 million. If I can refer you to page 6 and page 7 of the report, this is where we demonstrate our expenditure trends comparing this year to previous years. And there's 2 areas of pressure that we're currently seeing in the Health Board, one being in relation to variable pay. On page 6 in the little table on the top right of that page, you can see that there's been a significant increase in our spend in this area. There's ongoing focus, action and appropriate review being taken by the board to help manage this position. The other area to flag a pressure is in relation to our continuing healthcare packages of care. As referenced on page 7, you can see in the graph, the top right hand one, there's been an increase compared to previous years. Again, this is an area of focus and attention. If I can then refer you to page 8, this details our total spend and forecast spend in relation to our COVID response, both those direct and indirect costs. This is detailed against the main expenditure areas as included on the table. As you will see, we've spent just under 6 million year to date, and our forecast spend on COVID is 28 million. This spend is assumed to be funded within our overall financial plan. If I can then refer you to page 10, this is our ongoing tracking of our underlying financial position. We've discussed this at previous boards and in previous committees. So we're tracking in our opening plan deficit for this financial year of 5.6 million and how that deficit is moving as we move through the year. So in this table, we will be tracking our decisions made to invest recurrently and also the expected benefits to be delivered against those investments. The final thing really to flag before we pick up any questions is in relation to Appendix 5 and 6, where Appendix 5 is given a bit more detail in relation to our increased continuing healthcare spend against various packages of care. And Appendix 6 gives you a detailed list of all our current savings schemes, which are rated amber or green. And just a reminder to the board that our plan this year includes the assumption that we will deliver £1.7 million of efficiencies, within the financial year. So quite a quick run through of the report. Obviously the usual details in there. Happy to pick up on any questions or comments. Thank you.
Are there any questions, please? Comments? Again, lovely clear format, so that's excellent. Thank you, Pete.
Okay, thank you.
I think, yeah, that's good. No questions. I wonder if I might then in that case proceed to the item 3.6 and come back to the report from the Community Health Council after that, because Carol needs to step out, and perhaps if you could then just conclude with the assurance report of the board's partnership arrangements. So is that all right, Carol? If you'd like to do the executive committee first.
Yes, thanks ever so much, Chair. And can I apologise to board members? I'm afraid it is unavoidable that I do need to step out for an important meeting at 12:30. So pleased to be able to just comment on a couple of the papers that have been pre-circulated to you. I wanted to pick up under PTHB committees first of all, under 3.6a, if that's okay. The committee report in terms of the executive committee. Hopefully you feel that it's a comprehensive and easily accessible report. We have covered a lot of ground, and you'll see that some of the matters that we've discussed actually have come through to the board themselves substantively. But I just wanted to draw out two key elements, particularly for the board in this meeting. One is in relation to the change of pathways in relation to South Powys and the maternity and neonatal services in particular. As colleagues will know, the change in pathways from Neville Hall to Prince Charles Hospital happened for urgent and emergency care, and we're working on the maternity and neonates. So I just want to note, ask the board to note that the position is a likely delay in decision making on that on the pathway change. We're keeping that under review, and it's awaiting a position on a deep dive into neonatal services. So that's one area that I would like to raise. The other area is in relation to drawing down Office 365 licenses. It does amount to over £500,000. It is part of a pre-agreed process, but because of the significant nature of that resource drawdown, I wanted to highlight that and ask the board to both note and to support that ongoing collaborative development as well. So that's the Executive Committee report, Chair.
So are we happy to support that then, as Carol has asked, and allow her to carry on? I'm so sorry, we're jumping around the agenda here. Was there anything else, Carol, that you would
No,
like?
I just want, and I can see Francis has indicated yes, thank you, Francis. Julie is now with us, so Julie will, I'm sure, be able to do the local partnership forum. But in terms of the board's partnership arrangements, and recognising we've agreed the new committee that will include partnerships, I'm excited that we will have strengthened our arrangements for getting into more of the detail about partnerships. As a board and as a committee, but this is the usual report that members will have been very familiar with in the past about our other partnerships. Often when we talk about partnership, we think that's with the local authority, but of course we're in partnership with other health boards and other regions, both in Wales and in England. So this partnership arrangements paper covers a number of those, so it's largely for information unless anyone wants to pick up an issue at this stage, Chair.
Thank you. If there are no issues, then we can release you, Carol. Thank you. And
thank
I think
you very much.
Alison needs to join you as well.
Thank you. My apologies. Thank you. Bye-bye now. Bye-bye.
Bye. Could we then go back to agenda item 3.5 before we return to the Powys Teaching Health Board committees? So Andrea Blaney is going to present that.
Thank you, Chair. Pnawn da pawb. Good afternoon, everyone. Thank you for the opportunity to present our Chief Officer's report. I don't plan to go through it in any detail, but just to pull out 2 or 3 highlights from it. Through the pandemic, the CHCs are having to work differently. We're not doing any face-to-face engagement or visiting at the moment. So we've highlighted in the report a pilot project that happened in Anar and Bevan between the CHC and the Health Board there, where they did some virtual visiting, which was done through FaceTime. And I'm really happy to report that I had a very positive meeting with Alison Davis yesterday and some other members of her team. And we've come away with a plan to put in governance and procedures and planning in process with the aim of doing a similar kind of project in Powys in the early autumn. So a virtual visit over some kind of video platform. And that was really good. If I pick up on the mental health survey that we had running for young people, that finished over the weekend and we had 337 responses. So we're actually working through those responses now, and we'll be pulling together a report which outlines what young people have told us, and we will present that to the Health Board in the coming few weeks or months. We also have a very short maternity services survey online, which is asking people for their experience of maternity services over in South, and this came out from discussion at the Ockenden Report Assurance Committee, where one of our members is part of that committee. So that's just a short survey which we've got running online for the next few months. There's no end date on that at the moment. We've also highlighted that the Board of CHCs published a national report, Telephones, Tablets and Technology, hearing from people using digital ways of getting healthcare, and we've included a link to that report. The report's been issued to all health boards across Wales, and we're asking for a response or comment. And then finally, I think on membership, just highlight that Francis Hunt has been appointed chair of the CHC again, and David Collington as vice chair, and they will continue in those roles until the citizen voice body is established, which we anticipate will be April 2023. And we're awaiting Welsh Government public appointment recruitment process to start. We have 7 Welsh Government ministerial vacancies at the moment, and there are a number across Wales, so that's imminent. But we would ask if any board members know of anybody who might be interested in becoming a CHC member, just to look out for that process, and they can contact our new business manager, Claire Powell. So just to say, we've got our new business manager in post. She's been in post a couple of weeks. And finally, just reiterate our thanks to the Health Board for all of the work that's been done on the vaccination programme. Thank you very much. I'm happy to take any questions.
Thank you very much, Andrea, for presenting that on behalf of Katie. And is there any question or comment? It's good to see the emphasis on digital. Trish?
Yes, thank you, Andrea. That was a really interesting report, and I look forward to really hearing the results of the young people survey, and I think the virtual visit is really exciting opportunity yes. for us to get back in and understand what's happening in our hospitals, and yeah. So thank you for all the work you do.
Thank you very much.
Thank you, Andrea. Thank you very much indeed. I think now we can return to the assurance reports from the board's committees. Please correct me if I haven't jumped to the right place, but I think we're going to start with Tony Thomas and the Audit, Risk and Assurance Committee.
Can you hear me, Chair?
Yes, yes.
Thank you very much. I'll be fairly brief. The committee received 3 internal audit reports. Pleased to say they were all of reasonable assurance, one on safeguarding, one on implementation of digital solutions. Please don't ask me any detailed questions on digital solutions. Number 3, winter pressures and flow management, also reasonable assurance. External audit update was positive. And I think most of all, what I'd like to draw the committee's, the board's attention to was, I'm pleased to report that all health boards have to have an audit, internal audit opinion each year. And we have again received a reasonable assurance. That's the highest assurance you can have. So there isn't something higher than that. And I'm pleased and thank all the financial staff and all other staff for helping to deliver this. I got no further comments.
Thank you. It's really for information, but that's excellent news. Thank you, Tony.
Thank you.
On charitable funds, Rani, do you want to come in on this to begin with? Because there is an item certainly that you might want to comment on. The approval, applications to general funds for approval. We are actually encouraging people as much as possible to put in bids. So just a word from you on that.
Thanks, Chair. I wasn't going to go through this report in detail. I know you outlined an update at the start of the meeting, your Chair's report on progress with the charity, but in particular, if I can just draw attention to the funding that the charity has granted towards the Health and Care Academy. It's included on at the bottom of page 3 there. £180,000 has been granted towards the equipment and furnishings of the building to support the launch of that academy, which is a significant investment and progress in terms of our Workforce Future strategic framework delivery. So I just wanted to flag that. Thanks, Chair.
Thank you, Ronnie. And again, this is just for information, but I would like to emphasise the last item there, the investment manager's report, which is very interesting and encouraging. So thank you. Mel, your Experience, Quality and Safety Committee report.
Thank you very much, Chair, and just congratulations on the investments in the previous. It was really interesting reading, I have to say, you know, and it's really encouraging, as you just said. So anyway. The Experience, Quality and Safety Committee have met twice, and that was the 3rd of June and the 15th of June. And just to give my thanks to Trish Buckham as my Vice Chair for the 3rd of June meeting, we considered, as you can see in the papers, a variety of different topics, but I would highlight the Maternity Service Assurance Framework and Improvement Plan, which is really critical work, obviously. And I'd also brought to the committee's attention the clinical framework, policy framework, sorry, and the clinical audit programme from those meetings, which were also an improved position from previously, which is really encouraging. And also the safeguarding during the COVID-19, and that was a very interesting position as well. If we go on to the 15th of July, can I just ask committee members just to be aware of, we did a GP access service during COVID, which also the CHC took part in. That was very an interesting paper that people might want to look at. Our mortality report as well, once was a concern, much improved position for the Health Board. I'd recommend that one to be read. And I'd also say our concerns management, Chair, putting things right. The compensation claims report is also worthy of a good read. The whole paper's there, and I'd suggest for the board to be focused on that. And otherwise, unless anybody's got anything else they'd like to raise, I was going to leave it at that. Thank you.
Thank you. Does anyone have any comments for Melanie? Well, in that case, could I bring in Mark for his report?
Thank you, Chair. We've met once since the last board meeting. It was quite a full agenda, as you can see from the summary in the report, so I won't propose to go through it in detail. Just a couple of issues to highlight. We continue with our vigilance around performance and commissioning assurance. I think there are some positive signs, but we are in a state of fragility at the moment, and say continued recovery work will hopefully improve that. But I think Carol's summary earlier was very apposite and accurate. So whilst we do see some signs of improvement, there is still a lot of concerns, and particularly around referral to treatment times. Another interesting report we had was around dental services across the county. That was very informative, certainly from a personal perspective, as to how those dental services work as private contractors and their NHS input. So again, very important to actually understand that, and hopefully recruitment that was ongoing will be successful, and we'll also see additions to that service capability. Another important issue we had was moving towards dealing with legislative changes around deprivation of liberty protection standards, and an update as to, whilst it's going to be challenging, I think we've got mechanisms and strategies in place to actually deal with that transfer. That there has been some backlogs which will need to be addressed in terms of the new format, but we had good assurance from Alison in terms of taking that forward. So again, very interesting from the committee's perspective. We recently had an agenda meeting, and the next committee, which will be in the new format, will be on the 2nd of September. Thank you. Thank you.
I think that concludes the reports from committees. I'm not sure, Trish, whether I left you out. I can see that you wanted to make a comment a little while ago. I don't know whether that was about charitable funds or about Elle's report.
No, I don't know. It must have been a legacy hand, but no, thank you, Chair. I'm happy with the report that Melanie gave. Thank you.
All right, thank you. Okay, so I think that concludes agenda item 3.6, and we have already completed agenda item 3.7. So Julie, over to you for 3.8, the report of the board's local partnership forum.
Thank you, Viv. This, as people know, this is a committee that is acting as an advisory committee to the board, and I think you'll be pleased to see the range of topics that we've covered, particularly in relation to the topics that I know have been touched on today. Yeah. At this committee, we did review the organisational development strategic framework. We did have that feedback, and we've made sure that our partners are involved in terms of the renewal priorities, agile working, and a number of other areas. So I think that's all I wanted to report, Viv.
Okay, thank you. Again, just for information, but if anyone has a question, now is your chance. All right, thank you. Is there any other urgent business for this meeting? I've had no notice of any, so I will assume there is not. So that concludes the meeting, but just to say that we meet again today for our annual general meeting at 2 o'clock, and the next meeting of the board after that will be on the 29th of September 2021 at 10 o'clock. So thank you, everyone. See you soon.
Thank you. Bye-bye.